Good morning. So we have discussed about the plasma volume expanders and we have discussed in details about the few plasma volume expanders. So now what is the use of the plasma volume expander? So these colloidal solution are rarely are used primarily as a substitute for the plasma. Yeah, it is used as a substitute of plasma in the condition where plasma has been lost or moved to extravascular component. Now in case what is the cases? For example, burn. In acute phases there is a you can say that there is a loss of plasma and it is moved to the extravascular compartment, so we can give the plasma volume expander. In case of the hypovolemic and the endotoxin shock, it can be we can use this plasma volume expanders. Like in case of the severe trauma, in case of the severe trauma condition also it can be used. Next, in case of the extensive tissue damage, let extensive tissue damage also we can use this type of the plasma volume expander. And they can also used as a temporary measure in case of the whole blood loss, that until the same can be arranged. Now if there is a due to the any accident or other case, if there is a blood loss and if the time is taking to arrange the blood, so in that case we can uh, give this. But what is the problem with that? They do not have oxygen carrying capacity, clear? So they it will not work as a blood, but of course to maintaining the pressure volume we can use them. Apart from albumin, other plasma expanders should not be used for the maintenance of the plasma volume in condition like burn, where the protein leak out with the fluids for several days. So apart from the albumin, other plasma volume should not be used in maintenance of the plasma volume. Well, in maintenance of the plasma volume in case of the burn, because in that case protein leak out with the fluid for the several days. And what is the potential complication? Of course, with the some of the things like anaphylactic reaction with the heterostrach, albumin, or some kind of the dextran. Sometimes dextran may produced by the bacterium, so which contribute to the antigenicity. Allergic reaction, different type of the allergic reaction, and they are, you can say that like it may be the nasal congestion, wheezing, tightening of the chest, nausea, vomiting. These are the hypotension. These may be occurs in sometimes mild, moderate, or the severe case. And if such allergic reaction it was shown, we should stop the this plasma expanders therapy. And substance with the more than molecular weight 50,000 Dalton or less can be filtered by the glomerulus. So if it is less, then it will be filtered by the glomerulus. So you can say that that's why you can say that dextran is quickly filtered out, and they may cause the renal injury. Already we have discussed. Excessive administration of albumin, dextran, heterostrach can be participate cardiac failure. So that is also one problem. Pulmonary edema it can be occur, peripheral edema in the lower extremities, legs and all, it can be occur. Or you can say that it may cause the hypertension as well as the tachycardia. In actually, you can say that in the concentration of the plasma protein fraction may cause a higher incidence of the hypotension. In acute ill patient, measurement other than the central venous pressure suggests cardiac output may need, we should carry out those cardiac output studies to observe the actual situation. Fluid balance may need to be sustained in conjugation with the inotropic or cardiosupportive drug therapy. Now, bleeding is one of the major concern in case of the heterostrach therapy. Now, heterostrach appear to be effect in the total platelet count, and hemodilution can be exacerbated with after whenever we are using. A prolonged bleeding time, partial thromboplastin time, uh, or you can say the thromboplastin time, prothrombin time can be result from the temporary adverse effect. So these are the different potential complications. So though they are used for as a life saving, and when the other alternative is not there, we can use that, but we should consider their potential complication also. So these are the some of the references where you can go through and further details.